As Indians, do we have a chance when it comes to beating knee replacements? We see that Indians are having more and more replacements at a younger age than our European counterparts or our Caucasian counterparts. So what are the underlying reasons that are causing our people to have knee replacements at younger ages? The number of knee replacements that occur in India is increasing every year. Now, what are the root causes of this? The first thing is that India as a country is getting bigger. Our people are getting more and more obese. Because our people are getting more and more obese, there is more pressure on the knee joint, and that causes to wear and tear of the joint, and therefore the need of knee replacement. Secondly, in India, there is no system in place which checks our bones regularly. In European countries or in other developed parts of the world, all females, all males after a certain age have to go through mandatory bone checkups, which we don't have in India. Now, because we don't have those kind of checkups in India, what happens is that early diseases and mild symptoms are mostly neglected. Now, because these mild symptoms are neglected, we end up having patients who directly come to a doctor only when the symptoms have come to a level where the doctor can do nothing about it. The only thing which is left with the doctor is a knee replacement. So through this video, I want to emphasize that early detection in any disease, not just knee arthritis, is crucial for us to prevent the disease, stop it on its tracks, and not let progression. Third is our level of exercise and our physical activity. To prevent joint degeneration, it is important that the muscle strength around the joint is kept intact and the joints are not repeatedly put through stress in the lack of muscular strength. I see that in India, after the age of 50-55, the only exercise people are doing is morning walk. Now, morning walk might be good for your heart, it can be good for your lungs or for other organs, but for your knees, it is not giving any strengthening to the knee. So what I advise people is to do mix and match of strengthening and walking. So you can do 4 days of walking and 3 days of strength training to the knee. The next reason is our diet. Now, our diet, especially vegetarian diets, might have a lack of protein. Now, when there is a lack of protein, there is a degeneration of the bone, and collagen, which is an important part of the bone, is not formed at enough levels. Now, it is important that as any healthy individual eats 1 gram protein every kilogram of body weight. So it's important that you tabulate your weight and calculate how much protein you need to take and make sure that you are taking that amount in your body. The next very important point here is chronic vitamin D deficiency. Now, vitamin D is a super hormone. It's a super thing, not just for our bones, but for our other parts of the body, for our gut, for our skin, for our mood. Now, if there are 10 people in India, I think every out of 10, 8 people will have a deficiency of vitamin D. The main reason behind this is that we are not getting enough exposure to the sun. It is important that we start exposing our skin and ourselves to the sun so that there is enough absorption of vitamin D. Vitamin D is a super drug if it is taken at the right amount. Now, how do we solve this issue? We solve this issue by changing our lifestyle to match more of the European lifestyle. Now, I'm not saying that Europeans have a better lifestyle than us. I'm saying we should try to pick up the good points of their lifestyle and inculcate them into our lifestyle. So, if we exercise more, take control of our weight, eat better, get more sunlight, maybe our rate of degeneration of arthritis and our rate of degeneration of joint will decrease, and it leads to a longer, healthier and a more active life.